Maxim documentation. Presentation prepared by Joanne Gross, RN, and Amy Joyner, RN. Nursing documentation. When you document effectively, your patient's medical record reflects your professionalism. Why is documentation important? Documentation is defined as anything written or printed used to furnish evidence or information that is legal or official. With documentation, nurses are able to clearly describe the client's current health status, what interventions should be carried out, and if the interventions that were carried out benefited the client. Effective documentation provides a record demonstrating and giving proof of individualized nursing care and the patient's response to that care. It provides improved quality of care for the patient and accessible details in the event that a mistake occurs. It also helps to evaluate the performance of care and see if the standards of care have been met. At Maxim, documentation is also used for reimbursement. When it comes to nursing care, if it wasn't documented, it didn't happen. One of the most crucial aspects of nursing documentation is the legal significance. Nurses' record-keeping practices are subject to increased scrutiny. Documentation can provide legal evidence of the medical process. Nurses have a professional and legal duty to create and maintain honest, accurate, and timely medical records that do not breach patient confidentiality. Some do's and don'ts of documentation. Write in blue or black ink only, and not both colors on the same nursing note. Black, however, is best practice. Supporting documentation needs to be filled out every day. This includes your DME sheets, seizure logs, medication administration records. You must always write legibly. Correct errors in the proper manner. We'll talk about correcting errors in some coming slides. Document relevant information. Don't only document the things that went right, also document the things that went wrong. This will help you and others to determine the best course of action. Error correction. Put a lid on it. This means your error must have a line through it, your initial beside it, and the date beside it. Documentation checklist. On your nurse's note, you must have the full patient name on both pages. Your time in and time out must be completed and must be correct, and you must have your full signature, date, and title on the signature line. Documentation checklist. Please make sure that the time you take your vital signs is clearly noted on your nursing note. Pain intensity must be included with all vital signs. Pain is now considered the fifth vital sign. Pain should be documented appropriately with further information in the narrative note to include follow-up effectiveness and any further interventions. The pain medication should be documented in the MARS. Trach information should match doctor's orders completely. One area of the nursing notes that is often missed is patient education. This must be completed every shift. It can be taught to the patient or the family or another caregiver. Be creative when thinking of your topics. If you wash your patient's hands, include it as hand washing education. If you review your medication with a family member, include that as education. If you have questions about what to include for educating your patient, please contact your clinical supervisor. Documentation checklist. Your feeding volumes and your flush volumes must match your doctor's orders. Your hourly intake and output must be complete as well. Make sure to include suctioning on your other section. Does everything match your doctor's orders? Check yourself frequently throughout your shift. Let's practice. If your order reads, Pediasure, give 240 mLs via G-tube 4 times per day, and flush G-tube with 5 to 50 mLs water after medications, feedings, and PRN tube patency, and maintain aspiration precautions. How would you document if you gave 75 mLs of a water flush at one time? Answer to the practice question. Some options for documenting flushes are below. On the previous slide, the max volume of flush that was ordered was 50 mLs. Therefore, your flushing volume when you're writing it down must never be over 50 mLs. However, you had medications and you had feedings, and you did end up flushing 75 mLs. The following are a couple ways you can document that. On the first line, it's 50 mLs plus 25 mLs. That equals 75. However, neither volume is over the 50 mLs. The next line is 25 mLs plus 25 mLs plus 25 mLs. Again, you gave a total of 75 mLs, but your documentation shows that you gave 25 3 times, which is under your 50 ml volume max, instead of all at once. Please see your clinical supervisor if you need more clarification. Documentation checklist. Please make sure that your G-tube size correctly matches your doctor's order in your nursing note. If they are different, please contact your clinical supervisor. In your nursing note, you must also document the date that the G-tube was last changed. If you are unsure or you did not do it, please ask the caregiver or family member. The same is for the date the trach was last changed. That should be clearly documented on your nursing note. Again, if you didn't do it, ask a family member or caregiver for the date. Vent settings should match completely your doctor's orders on your nursing notes. Documentation checklist. Remember to call the office to notify us of all new orders. Transcribe any new medication orders to the MAR and med profile using the name of the drug, the dose, the route, and frequency. If you need more help or want more information on how to transcribe these orders, please contact your clinical supervisor. Your narrative note. Each entry should be timed. The very first sentence of your narrative note should state who you received report from. Was it from a previous nurse? Was it from a parent? You should document skilled care every couple of hours. And at the end, make sure you document who you left the patient with. Please make sure your handwriting is legible. Documentation checklist. Initials and the time a medication was given must be documented on the MARS. If you do not give a medication, but the family does, please leave it blank. Do not write that the family gives it. The only writing on the MARS should be when you give a medication and you date and time the med. Please remember that the MARS, the DME sheets, seizure logs, vent sheets, all miscellaneous papers are due in the office every week. This is a new Virginia state policy. And please notify us promptly when you are running low on supplies and paperwork. We don't want you to be without, and especially in the pandemic when the clinical supervisors are not coming to the house frequently, we need to be able to send it to the house in a timely manner. Did you know that a write-over is an error? A write-over is when you're trying to correct a word by writing over it. If you look on the left side, that's a write-over, and those are wrong. What you must do is correct it, just as if you correct an error by putting a lid on it. A line through it, your initial, and the date. Please review this infographic for 9 types of nursing documentation errors. Now let's take a quiz. Please answer true or false to the following questions. 1. You can use any color ink when documenting on a nursing note. 2. Your documentation must match your patient's doctor's orders. 3. All nursing documentation needs to be turned in every week. 4. A write-over must be corrected like any other error. And 5. A nursing note does not need to be completely filled out every shift. To get credit for this training, email amjoiner@maxhealth.com when your training is completed. In your email, please include the name of the training and the answers to the quiz questions on the previous page. Also include your name and title. A certification of completion will be emailed to you. If you would like additional information on documentation, please contact your clinical supervisor. Thank you for your participation. Your nursing care is so valuable to Maxim Woodbridge and to the families that we care for.